The coronavirus may be gaining ground across Virginia, but the fight against it is forging ahead.
We see therapeutics advancing at a rapid rate. We're seeing actually vaccination developing at a rapid rate, and we're seeing people's involvement. So this is a very unique time, a unique situation.
Dr. Aaron Hartman, a physician and clinical researcher helping to develop a COVID-19 vaccine, has been tracking the virus since January. He says the ways of thinking on how to combat the illness have come a long way.
If you were intubated in March with this disease, you had an 89% chance of dying. Now it's 23%. That's never happened before in the history of the world.
That massive shift in the mortality rate, he says, is largely due in part to therapeutic medicine, treating COVID with different forms of therapy or drugs.
Typically, when someone comes to the hospital and the oxygen level is low, the first thing you do is intubate them. What we learned with these COVID-19 patients is if they're comfortable, even if their oxygen's low, just give them some oxygen, turn them on their stomach, they actually will be okay.
I hate needles.
Other promising therapeutics include treating COVID patients with convalescent plasma from someone who has fully recovered from the illness, and drugs like dexamethasone and remdesivir that Hartman says have helped to lower the risk of death. Much of the research, he says, has been leveraged from other countries such as Italy and the UK.
This whole thing with COVID-19 is unique in that the whole world's involved.
A worldwide effort toward a common goal. Antoinette Delbel, News 3.